And the thread that unites all of these problems is metabolism.
Metabolism. And at the end of the day, you have to talk about mitochondria in order to understand metabolism. Only 7% of US citizens have no signs of metabolic health problems, meaning 93% or so of US residents will have at least one of the biomarkers of metabolic syndrome, meaning they have prediabetes or abnormal lipids or high blood pressure or abdominal obesity or abdominal fat, excessive abdominal fat.
So what do we offer those 93%?
So those people, diet interventions would absolutely be a part of a healing strategy. A part of it, not the only strategy. I would want to know about their sleep. I would want to know about substance use. I would want to know about medications, lots of things. But for dietary interventions, I would want to meet them where they're at and just find out, well, where are you at? What are you eating? Do you have preferences or demands for what your diet should be?
Could you give me a case study then? Maybe a more extreme case study from your practice that you've seen.
I can give you the simple cases which probably apply to the majority of human beings on the planet. But if it's okay, I'd rather give you the extreme case, because a lot of people are skeptical. They probably hear me saying this and they think, well, you're just talking about general health and wellness. What about people with real mental illness? What about people like your mother whose lives were decimated by mental illness? This doesn't have anything to do with them. And what I'm here to say is, no, actually, this has everything to do with them too. But yes, it applies to just common everyday people. But, probably, so one story that I will just share because it's probably one of the most powerful stories I know. It was a woman whose real name was Doris. And in the book, I called her Mildred because I changed everybody's names. But she actually gave me permission to use her real name. So in honor of her, I want to use her real name. So she was a woman who actually had a horrible abusive childhood, lots of trauma. And by the time she turned 17, she started having daily hallucinations and delusions and was diagnosed with schizophrenia. Over the ensuing decades, she tried numerous antipsychotic, mood stabilizers, antidepressants, and other medicines, but none of them stopped her symptoms. She remained with all of the symptoms of schizophrenia. She ended up gaining a massive amount of weight. She ended up weighing about 330 pounds by the time she was 70. Her life was devastated by this diagnosis. She had a court-appointed guardian to manage her financial affairs and other affairs. She had professionals coming into her home to help her with paying bills and grocery shopping and stuff like that because she couldn't do it for herself, which is not at all unusual for people with schizophrenia. And between the ages of 68 and 70, she tried to kill herself at least 6 times and was hospitalized for those suicide attempts. She hated herself and she hated her life. When she was 70 years old, her doctor told her, "You're overweight and you need to go lose some weight." And she was referred to a weight loss clinic at Duke University where they just so happened to be using the ketogenic diet as a weight loss tool. And for whatever reason, she decided to give it a try. And so she tries the ketogenic diet. And within 2 weeks, not only does she start losing weight, but she notices dramatic reduction in her hallucinations and delusions. Within months, all of her symptoms of schizophrenia were in full and complete remission. She starts tapering off her psychiatric meds. Within about 6